Good evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently 7 o'clock, just a little bit after actually, on Thursday, the 18th of June. And I want to do today's daily recap of events that affect the way you get, protect, and enjoy your money, your life, and your retirement. The question for today is, what does it all mean to you? And we'll get to that in just a few minutes. And we start every day, as we've been since early March when I started doing these things, as to what's going on with the current COVID cases. That's still the predominant issue in the nation right now, and the same thing that affects most everyone's lives at this point in time. Right now, the current COVID case count is 2,181,000 cases right now in the U.S. That's just under 24,000 new cases. Since the number of deaths in the U.S. right now are 118,279. That's up another 657 people who have died since yesterday when I was doing the show then. Now, New York still has the highest number of cases. Total case count, anyway, is 385,760. Okay, that's a big number. However, their total cases since yesterday are 142 new cases. 142,000. That's, not obnoxious. It's not pleasant, but it's certainly not obnoxious for where they're at, 142 cases. Now, their deaths right now are at 30,967. So 28 people, only 28 people have died since yesterday in New York State. So that's a big improvement for them when they were getting consistent triple-digit people that were dying. And we covered a few of those individuals a couple months ago. Because again, these are individuals. It's easy to count the numbers and say, oh yeah, it's bad. However, each one of those people, each one of those cases, each one of those individual deaths is somebody's family member, somebody's friend, somebody's coworker. And it leaves an impact on a lot of people. And we'll get to that in just a little bit, actually. New Jersey still has the second number of highest cases, 168,000 cases right now. They picked up another 400 cases since yesterday. Their deaths right now total is 1,289,000. So they've only had 34 additional deaths since yesterday. So New York and New Jersey are moving in where they want to be anyway. California got the number 3 spot, and things are happening now in California. And we'll get to that in just a couple of minutes. Okay, Illinois has a number 4 spot. Massachusetts at number 5. Pennsylvania is still at number 6. Texas is number 7. Florida's number 8. Michigan's number 9. And Maryland rounds out the top 10 with the highest number of cases. Now, the death rates and the total new cases anyway, have been declining in New York and New Jersey. And they've slowed considerably from where they were even just several weeks ago. But again, people are still dying, and the rates of infection are still going up in other parts of the country. Excuse me. Specifically the South and the West. They're seeing some rather interesting things happening. Now, this is happening even as all 50 states have gone to some type of reopening. Some states never actually closed. Some states are going from phase 2 to phase 3 at this point in time for them. So that's getting interesting real fast. The chances for a vaccine ready for widespread use before the end of the year are really, really slim to none, despite what the president has to say about that. Now, President Donald Trump also dismissed the need for another shutdown of the American economy. And that's even as 14 states log in record high numbers for their individual states for coronavirus infections in recent days. Now, he said, we won't be closing the country again. We won't have to do that. This is what Trump said in an interview on Fox News on Wednesday evening, I believe. Trump had previously stated that in May that the U.S. wouldn't be locked down again. Okay, if there was another surge in cases, arguing the country is in a position to put out the fires. That's what he said, put out the fires. And in recent weeks, top administration officials, including Treasury Secretary Steve Mnuchin and National Economic Council Director Larry Kudlow, have pretty much said the same thing. Okay, they're in no rush for anything. They don't see another lockdown coming. Okay, and Mnuchin said, we can't shut down the economy again. He said that in a CBS interview. I think we've learned that if you shut down the economy, you're going to create more damage. Again, these are people who are just looking at the numbers. And these are numbers guys, and I don't have a problem with that. But there is a flip side of things. Now, at least 14 states right now are registering positive cases at rates outpacing the average number of administered tests, suggesting the transmission of the virus. Now, almost all these people say, well, if you test more, you're going to get more cases. Well, you just know about more cases at that point in time. However, now they're having more cases than they're administering tests. So what do you think is happening with that? The virus is actually spreading in certain cases. Now, cases are increasing in Florida, Texas, Oregon, South Carolina, among others. The coronavirus caseloads continue to surge across the South and the West. Arizona announced 2,500 new cases, on Thursday morning. Florida announced 3,207 cases. California reported 4,000 cases, all are new highs. Now, coronavirus hospitalizations in Arizona have doubled since Memorial Day, with public data showing that inpatient beds across the state are at 85% capacity right now. Most of California's new cases, are in the Los Angeles County area. Now, over 115,000 Americans have already died from coronavirus. So, just so far, and around 800 new deaths are reported every day on average. But that puts the U.S. on track for a total of 200,000 deaths by the end of September. 200,000 deaths. Now, remember when this was back at 30,000, people thought that was terrible. By the end of September, we're looking at over 200,000 Americans could die from COVID. Now, the Trump administration has really left most of this to the states to decide their individual paths on easing public health restrictions and reopening their economies. And that's pretty much been his game plan from the beginning. He didn't want to take responsibility for it. At first, he said it's going to go away. There's only 5 cases, only 15 cases. It's going to go away by itself. It didn't go away. The case count grew. He didn't institute national testing, late to the game on that. And now you've got what you've got. He's been pushing over to the states for quite a while. Dr. Anthony Fauci, who's been leading in this on the public health side, he's the director of the National Health Institute of Allergy and Infectious Diseases. He told the Wall Street Journal on Tuesday, people keep talking about a second wave. We're still in the first wave. That's what he said. We're still in the first wave. It just hasn't hit some areas yet. And it's starting to now as their numbers start to rise. And we'll see what happens as things go on. Now, the pandemic, without a doubt, plunged the U.S. into the worst economic downturn since the Great Depression. Today, they released the numbers, and over 1.5 million people filed for unemployment benefits for the week ending June 13, and that's according to the Labor Department. Now, it's the 13th week in a row that filings for those benefits have topped 1 million. Californians are now required to cover their faces in most settings outside of the home. California will now require roughly 40 million residents to cover their faces in most settings outside the home, according to the State Department of Health. They made that announcement today. The same day, it reported a record high of new coronavirus cases. Now, people in California must wear face coverings when they're working outside of or in line to enter any outdoor public space. And when outdoors in public spaces, it's hard to stay, 6 feet away from people. They're not in their household. Now, other situations where face mask coverings are going to be required include waiting for public transportation, waiting or actually riding public transportation, in taxis, in ride shares, interacting with a person and any member of public health, anytime you're out in the public. when you're receiving health care or you're out and about. Pretty much, okay, every situation. Now, there are exemptions, okay, including for children that are ages 2 and under, and for people with mental health, or development disabilities that prevent them from following the new rules. Now, the Centers for Disease Control and Prevention recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, okay, such as in grocery stores. Okay. Again, this has been back and forth, and this is the latest. This has been current for pretty much the last 2 or 3, 4 or 5 weeks or so. Initially, they were against the wearing a mask, but as things develop, as they get more information on how the virus spreads and what's effective and what's not, there's pretty much a consensus that wearing masks slows things down. Now, science shows that face mask coverings actually work. Now, that's what Governor Gavin Newsom said. He's in charge of California out there. Now, simply, okay, put, we are seeing too many people with faces uncovered, putting at risk the real progress that we've made in fighting the disease. Meanwhile, mask mandates continue to generate controversy around the country. Other states have also required face coverings in certain situations and settings through various strictness, okay, and mask mandates. And it has really become a political flashpoint in many parts of the country. And you wouldn't expect it, but it has. Now, some people resist further restrictions on their daily lives. Local governments in Texas, for example, are not, okay, they're not allowed to require face masks. Okay. The local governments in Texas are not allowed to require a face mask. Okay. Now, the Nebraska governor, Pete Ricketts, told the counties that they'll lose their federal funding if they require masks in offices and courts. Okay. The governor was going to hold the federal funding for the localities if they required masks in public offices and in public courts. Yeah. With a hotspot in a meatpacking plant and about 1 in 12 residents infected to date in Nebraska's Dakota County, it's been unusually hit hard with the coronavirus. But the county officials told reporters that they had little choice but to reluctantly scrap the health precaution at their courthouse this week after the governor said that they just weren't going to put up with requiring those officers, okay, to wear a mask. Otherwise, they just wouldn't get their federal funding, okay, under the CARES Act. So that's a big deal. You got to function. But here you got the governor putting a kibosh on the entire thing. Now, the governor encourages people to wear masks, but doesn't believe that the failure of wearing a mask should be a basis of denying taxpayer services. Knowing these numbers and the rates of death, why would you threaten us that you're going to withhold funding? And that's what a county assessor, Jeff Curry, said in an interview. Okay. Other local officials in Nebraska also have pushed back against the governor's requirements. Lancaster County board member Deb Shore told the World Herald, okay, it's one of the local papers there, okay, love local control, and argued that they know best what's best for their county. And really, you know, with the difference of the coronavirus is making in individual counties, the local people want to require masks, but the governor is saying no. It's an amazing thing. The governor will say, yeah, it's a good idea, but he's not going to require it. And if you require it in your local community, he's going to cut your funding. Things have gotten a little strange here. Now, the governor's office did not immediately respond to an inquiry from the Washington Post when they asked about this. The face mask rules have really led to a lot of friction between the state and local leaders elsewhere, too. Now, in Texas, in fact, okay, for example, Texas forbids local governments from mandating them and drawing criticism as some officials look for ways to tamp down rising case counts and hospitalizations in their communities. Now, the locals see the numbers. They see the numbers going up. But they're not allowed to mandate the mask because the state says they're not allowed to mandate the masks. Okay. It's recommended, they're encouraged, but they can't mandate them. Now, Texas students are going to be returned in fall, according to Governor Abbott. State education officials said that parents can choose to have their children with health concerns educated remotely. And that was reported in the Texas Tribune. Again, another local paper there. The announcement comes as Texas sees a surge in new coronavirus cases and hospitalizations. Abbott has already acknowledged the concerning uptick, but maintained that the reopening plans will proceed, in part because the state still has hospital beds available. Okay. Just because you got beds available is a real good reason to be pushing ahead with this thing. Now, several states in the South and the West are reopening or reporting daily records of infections. Arizona, Florida, and California all saw new highs on Thursday, today. While states are gradually lifting lockdown measures imposed in April and March, health officials have warned of a possible second wave of the virus. Now, Fauci already said that they didn't finish the first wave yet. These states are just getting hit the first time through. While New York and New Jersey and New England were getting hit big time, wasn't much going on in some of these states. And they thought that, well, we're just immune enough, it's going to happen to us. Well, it's happening now. The first wave is hitting them now. This is not a second wave. This is the first wave hitting them now. Now, the risk of intensifying an outbreak will also increase in the fall, especially concerning for schools, parents, and students because of the flu season and the change in weather. Experts said could really amplify the spread of the virus. Now, New York Governor Andrew Cuomo said on Thursday that he's now considering a quarantine order for travelers from Florida. And the latest signs of the states are reversing fortunes. Now, I don't know if you remember a couple months ago, Florida was trying to restrict anyone coming from New York State into Florida because New York State was a hotbed. Things have changed. What a surprise. Okay, again, the first wave hits certain people in certain areas differently at different times. Right now, it's a tale of two cities, Cuomo said. And he said he's really planned to at least, look at what's going on with this. And he may very well listen to his public health peoples and institute that restriction for people from Florida. Now, you wouldn't really expect that much of a turnaround, but it's absolutely amazing. President Trump called coronavirus testing overrated and suggested in a Wall Street Journal interview that some people wearing masks, not as a health precaution, but to signal their disapproval of him. It's amazing. Everything that goes on in the world, it's all because of him. They're trying to get back at him. They're trying to attack him. Whatever it is, it's all because of him. Okay. He also continued to defend his handling of the pandemic. I personally think that testing is overrated, even though I created the greatest testing machine in the history. That's what Trump said on Wednesday in an Oval Office interview with the Wall Street Journal. The paper continued to report that Trump cited more testing as the reason there are more confirmed cases. Okay. And you're hearing this a lot. It doesn't make any sense. Think about it for a second. If you're testing, you're just confirming what's out there. Just because you didn't know it didn't mean that it didn't exist. They were still there, you just didn't know about it. So when you're testing, yeah, you're going to get more cases because now you're finding out what's actually out there. So take a break when you hear this, okay? It doesn't make any sense. In many ways, it makes us look bad, is what he said. Trump also criticized the way that people wear masks and implied that wearing one makes a person more likely to be infected. Okay. Another off-the-wall statement. Sorry. Okay. I may not be a Trump supporter, but I do support some basic science. And Trump's analysis of that just doesn't cover it by a lot. Now, at Trump's indoor campaign rallies in Tulsa on Saturday, actually moved to Sunday. Okay. It's going to be the first time that attendees will be given out masks, but not required to actually wear them. And again, all these people were required to sign disclosures saying that they weren't going to sue should they get COVID because they were there. So if COVID is no big deal, okay, and it's a big hoax, then why do they have to sign waivers? Interesting thought. Anyway, that brings me to the question for today. Okay, what does this all mean to you? Now, states are going to continue to reopen. Okay, the chances for a national shutdown are basically zero at this point in time. Okay, the president just won't have any of it at all, and it's been resounded by top administration officials. Okay, now that's amazingly clear. It's just not going to happen. Now, with the election coming up, he's really trying to put some serious distance between himself and this whole situation. He's acting as if there's no problem at all at this point in time. Now, on top of that, the American people, they're just not mentally ready for a shutdown again. It's just not going to happen. They've had enough. They're moving on, and they're going to accept the new norm as it is. Okay. Social distancing and wearing masks. There are still a number of people out there that have interesting four-letter words to say about wearing masks. Okay. And it's because chances are they just haven't been personally affected. It's amazing that there's still controversy about wearing masks. It really is. If you've been personally affected by COVID, there is no question in your mind that you need to wear a mask. If you have not been personally affected, and you've got tons of reasons for not wearing a mask, okay, it's bad for your health, it's an infringement on your rights, I'm not going to live in fear, tons of things. Despite that the science, okay, says that wearing a mask works. Although, if you're of the persuasion that wearing a mask is bad for you because there's some off-the-wall article somewhere, okay, you're going to deny the science too. Even as all the locals, okay, want to mandate masks as these cases keep going up. Now, it's been in all the states, all the municipalities, that they're having an increased count of cases. They want you to wear masks, and it should be based on local conditions. So the local people is really going to know what's going on. So as you as an individual, you also need to make decisions based on what's going on in your local area as well as your personal situation regarding your risks for you and for your family. Those decisions should really take into account the COVID situation in your area, you and your family's existing age, and your existing health, as well as your financial situation. None of these decisions can really be made in a vacuum. Okay? You need to weigh all the factors and, in the end, do what's right for you. And that's what people are trying to do. I just wish they, base a little bit more on more science. If you don't want to wear a mask, that's fine. But it's difficult to say that they don't work or they're going to get you sick because there's no science to back that up, despite the one or two outliers out there that are coming off the wall. So what's it all mean for you? If you're watching this, okay, chances are you're not part of the 1 or 2% that has, for the last 40 to 50 years, been getting all the tax breaks and all the best health care that money can buy. Chances are you're part of the working class of folks. Some of you may be in the lower end of the economic spectrum, okay? Some may be in the higher end. Either way, you're on your own. And you've always been on your own, and you've known that for quite a while now. Okay? If you're 50 plus, you've been getting the short end of the stick for years right now. And you're not asking for a government check, and you don't expect a Lamborghini or a 30-bedroom mansion on a beach. Those would be nice, but you don't really expect them at all. But what you would like is a reasonable retirement, a house that's actually paid for, a reasonable car to drive, and enough money so you can travel a little bit every now and then. Don't need to go on a cruise every 6 months, but every now and then you should be able to get away. However, the money has been really flowing to the upper 1 to 2% for years. And your chances of seeing anything that remotely looks like a reasonable retirement, okay, gets further away with every passing day. Now, because your retirement plans really got diverted along the way for a myriad of reasons, okay, over the years. And the biggest one right now is the COVID. But even before COVID, okay, you were on a shaky situation to begin with. You were pretty concerned then. And you're relatively certain that you didn't have enough money. And if you thought you had enough money, you still have this lingering thing in the back of your head, maybe I'm not going to have enough money to actually retire. And that's happened for things just happen along the way. You get married, you get divorced, you lost your job. Okay, chances are you've changed jobs a dozen times before you hit age 50. And now you're 50 plus and you're trying to figure out how to get the cash flow you're actually going to need to be reasonably comfortable in your retirement. Okay. You don't want to be pinching pennies. You don't want to run out of money when you're 80. That's the people's biggest fear right now. According to the AARP, people fear running out of money more than actually fear death itself. And right now you have only a very, very short window of time to make any substantial difference. And the saving a traditional way for 30-year plan just hasn't worked for you at this point in time. You haven't been able to save $800, $900, or $1,000 a month for 30 years. That hasn't happened for all those reasons that got you where you are right now. And there's a point, okay, that you figure out that, God, I'm probably going to end up having to work until the day I die. That's if your health holds up that well. Your friends and family have been telling you that for years. They think you're going to be working until the day you die. And right now you're actually starting to believe them. You thought it was a possibility before, but, after the COVID situation, okay, the most recent market crash, you really wonder what's happening. There's still a chance, though, for you. There really is still a chance for you. Okay, you can have the ability to go away for that long weekend and decide that you like where you're at and just stay a week or so. It's okay. You can do that without having to worry about a job, without having to worry about cutting back your lifestyle at all. You don't have to just sit in a house and wait to die. You can actually enjoy your life. You can travel around, do the things you want to do. You can do the hobbies that you want to do. You want to visit the grandkids. You can take them down to Disney every now and then. Maybe once a year, take the grandkids down to Disney. You might enjoy that. Okay. Now, if you're listening to me right now, okay, I'm here to tell you it's not too late for you. It really isn't. You can get the new job skills, new skills that'll give you a certain amount of confidence in your ability to actually control your life, control your money. So you don't have to worry about just surviving. You can actually retire in style. Okay. Now, I may be able to help you get there. I may be able to help you get that control back in your life. I may be able to help you get the cash flow that you'll actually need so you can retire in just 3 to 5 years and never have to worry about stock market crashes again or working again. Now, I can't help everyone. I'm retired myself at this point in time. This is what I do to amuse myself in retirement, my way of giving back. I enjoy that, and I like to help out when I can. But I can't help everybody. There's only one of me. And I'm not interested in putting the business together with tons of people. So go to my site, drrousenow.com. There's a 12-minute video there. Explains the program. Take a peek at it. If you're interested, schedule a call. Don't put it on a to-do list. Schedule a call. And we can at least chat and see if I can help you or not. Now, you're not going to be getting a call from a call center in India. It won't be from one of my team members. If you schedule a call, I'll make the call myself because I personally want to see, do you really have a need or not? If you do, can I actually help you or not? And third, do I think that we could work together? Now, the nice thing is it doesn't cost you anything. And you can't buy anything on the call. The only reason for the call is to see if I can actually help you or not. So go there, drrousenow.com. Take a peek of the video. See what you think. It'll be a little bit different than what you've seen in the past from anybody else. But the program works. I've been putting a few people through every now and then since 2010 when I rolled this out to clients. And people have been happy. And I get some emails every now and then saying, oh, yeah, this is working great for me and all the money they're made. And it's nice to get those emails. Now, I'll be posting this video tomorrow on YouTube at some point in time. Like and share it there. Like and share it here. Put your comments under below. Put your comments on the video when I share it on YouTube. The channel there is The Real Money Doctor. And again, I appreciate spending some time with you. I look forward to spending some time with you again tomorrow around 7 o'clock. Thank you.